We know from the literature that around 1/3 of autistic individuals don't develop spoken language beyond a minimal level. They only have a few words or phrases, and we're just beginning to study communication in these minimally verbal autistic individuals. Much less is known about their receptive language skills, which means how much they understand spoken language, and that is the main focus of the study. In this study, we set out to investigate the range of receptive language abilities among minimally verbal children and adolescents with autism spectrum disorder. We explore how this may be related to age and sex. We also investigate how their receptive language skills might be related to social skills, autism symptoms, cognitive and motor skills, as these have all been shown to be related to language in more verbal individuals. Finally, we also interested in how this in those individuals whose receptive language is significantly better than their minimal expressive skills, and which variables may be related to this discrepancy. Minimally verbal autistic individuals were often excluded from previous research, partly due to their language levels. For this project, we really wanted to have a large enough sample size to make the results more valid and robust. So we reached out to two large-scale national databases, the National Database for Autism Research, sponsored by the US National Institute of Health, and the Safari Base, which is supported by the Simon Foundation Autism Research Initiative. We were very fortunate to get access to some de-identified data shared by these two organizations through a data sharing agreement. So we truly appreciate their support and generosity in allowing us to use this data. And from these databases, we identified 1,579 minimally verbal autistic children and adolescents between 5 and 18 years old in our project. This sample size is huge compared to what we usually can get from in-lab studies. Using this data, we were able to include several measures into our project. So we used the Autism Diagnostic Observation Schedules, the ADAS, to verify these participants' autism and minimally verbal status. We used standardized language measures, the preschool language scales, and the parent reports the violent adaptive behavior scales to investigate these participants' language profiles. And we included other measures such as the differential ability scales for cognitive abilities, violent for social skills, and the developmental coordination disorder questionnaire, the DCDQ, for their motor skills. Then we investigated how these factors were related to receptive language skills in minimally verbal autistic children and adolescents. 3 key findings from this project. First, we found that minimally verbal children and adolescents not only demonstrated much lower receptive language skills compared to their neurotypical peers based on both standardized language measures and parent reports, but their receptive language gap also widened as they age. And second, we found that overall, minimally verbal autistic children and adolescents with better social skills also have better receptive language skills. The most important finding from this project is that we found that around 25% of minimally verbal autistic children and adolescents show significant discrepancies between their receptive and expressive language skills, and they demonstrate much better receptive language skills compared to their minimal expressive language skills, even though their receptive language skills still fell behind typical development. And in this subgroup, motor skills emerge as the only significant factor predicting the discrepancies between receptive and expressive language above and beyond all other factors. And those with better motor skills are more likely to have much better receptive language than expressive language. Like, first, we really should provide targeted interventions to this population earlier, because, our findings shows that the gap between minimally verbal autistic individuals and typical neurotypical peers really widen as they age. So really, the earlier the better. And when we develop and also implementing these interventions, sometimes we forgot that they don't have that ability to understand complex sentences. And that also often happens, when we work with them. So what we really want to suggest is we keep the instruction as simple as possible and make it clear. Instead of saying some complex sentences this individual may not really understand, use simple words, maybe even include some graphics to really explain what we expect them to do. And that may be better, especially considering their receptor language level.